ready to hear, and you elicit a question. So it's very important that you ask them personal questions. So when you ask them, then they have the opportunity to speak to you. Ask about the caregiver. Now, again, I'm a pediatrician. Most of the time, sometimes you have a child with, say, cerebral palsy, congenital heart disease, any severe problem. The mothers are fatigued just looking after the child. So sometimes you have to ask the mother that how are you doing? And when you do that, suddenly they become quiet. Sometimes tears start going down their eyes. They come out with a whole lot of stories about how they are finding it difficult to. So our role as a doctor is not only to give medicine, but to look after the caregiver. Because unless the caregiver is strong, you are not going to be able to look after the child well. So looking after the caregiver is important. Asking patients about their personal journey is also very important. Sometimes, you have to go out of your way. So one doesn't do it routinely, but if you're worried about a patient, sometimes it's a very good idea to just call them back that how are you doing just after a week. Supposing someone has lost someone, you ring them up a week later and say, how are you doing? So it just gives such an opportunity for the patients to come back to you and seek help. Otherwise, they feel doctors are too busy where I'm going to disturb them. Then we can identify so many problems and help them. Sometimes you have a house visit. Now, normally I don't do house visits. I have an assistant who does it. But occasionally the child is incapable of coming or whatever reason. Occasionally you volunteer a house visit and it goes a long way to establish your. In medicine, we are actually blessed that we are blessed. If you read about the Harvard happiness study, those who haven't seen it, please Google Harvard happiness study. And it's a very brilliant 12-minute talk about what gives rise to happiness. And in the medical profession, we have a great opportunity to be really happy with ourselves and with our work. So the Harvard study says that health is important, a certain amount of money is important, but the most important thing is relationships. And in medicine, what I have found is that when you're available as a doctor, not only your family, not only your friends and your patients, they can all seek your help. And this gives you a sense of community and a sense of purpose. So we can use this very productively, and it's great for doctors to have this experience. Now, personal life and finances. This is very important. So many times I have students who come to me and they say, should I become a doctor? So I ask them only one thing, that what are your choices? And if he says, I'm going to become a lawyer or an accountant or finance or medicine, I tell them medicine is not. But if they say that I just want medicine very badly, then I say, so it's important to realize that medicine is a calling. It's not a job. It takes a lot out of us to be good doctors. But while we are doing that, self-care is important. I've already shown a slide which shows that doctors experience burnout, the depression rate is higher, and they have a lot of personal problems. So have to look after ourselves. We should not feel that we are indispensable and work beyond any limits to our own detriment. So emotional health is very important. Like we said, that 27% of doctors go into depression at some point. So we need rest, recreation, vacation. We need to look after our family. There's just no sense if we look after the whole world and our family feels neglected. We have to look after our physical health. Now, this is shocking. In the West, like in USA,